Okay, welcome back, ladies and gentlemen. This series of conversations that I've been having with people to try to show different lenses as to how people are dealing with the coronavirus epidemic from the faculty, student, and just personal perspective, and try to reach out to different people in different fields, different disciplines, and see how they're reacting, what advice they're giving to their students, to other faculty, and to just humanity in general continues. Today, I am going to have a very interesting conversation with someone who I think their field of study is very relevant to what is going on. This is a person who is in the idea of the health sciences and health promotion. But moreover, this is someone who has, I think, will have a really interesting perspective on what students and faculty alike are going through, because it's a person who is in their first year of being a professor outside of graduate school. And it's also a person who happens to be teaching a mix of both graduate and undergraduate courses. So I'm very excited about this conversation. Let's see if we can get it started. Okay, great. I think that we got you. Hi, Alice, can you hear me?
I can definitely hear you. Hi, James, nice to see you.
Nice to see you. So I was just telling, myself, I guess the camera here, that I'm super excited to have this conversation with you. So Alice Fiddean-Green is a professor, assistant professor of health promotion at Springfield College. And I was saying that I think that you're someone who, this would be a very timely conversation because of your discipline in health, but also because you're someone that is not only a first year faculty member, but you're also someone who teaches a mix of both graduate and undergraduate courses. So talk about being thrown to the wolves in your first year. But before we get to that, thank you for being here today.
Thanks for having me. I appreciate it.
So before we jump into all those specifics about you, I want to just go through some rapid fire stuff because, you and I both kind of know the intent as to why I'm doing these videos. And so a lot of the students that will watch this on my end probably may not be familiar with who you are. And probably some of the students who watch this on your end probably don't know who I am, that's fine. But so why don't you tell us really quickly, who are you, what do you teach, and kind of what got you into that particular field?
Okay, well, so I teach health promotion classes, and they're grad and undergrad. So mostly the undergrad students are going to be K through 12 health educators or doing physical education and health education. And then there are some students in the health promotion programs that do community-based health promotion work. So that would be, working with community-based organizations and hospitals, doing health education, so that kind of thing. And so I completed my PhD in public health from UMass Amherst. And so I came a little bit later in life to academia, and I actually thought for a long time that I wanted to be a midwife. And so specifically a home birth midwife. And so I trained for a while doing that, and I realized that that was pretty difficult, especially home birth midwifery. Birthdays, holidays, you just pick up the phone whenever someone's having a baby and you go. And so that was sort of challenging. And so I switched into public health and health promotion, because unlike the sort of one-on-one care that a medical professional would provide, public health and health promotion is thinking more about community-based health or population-based health. And so that's how I ended up where I am now.
Awesome. So you're in getting there, right? Congratulations, PhD, UMass Amherst. That's great. What was your, if you weren't teaching right now and inundated with moving to online, and you were focusing on your research, what would that research look like? And what types of things do you look at?
So broadly, reproductive health and reproductive justice and equity. And so very specifically right now, it used to be around pregnancy and childbirth, but in the last few years, I switched very specifically to working with pregnant women and mothers with substance use disorders. And I work locally, so most of the work I've done has either been in Hampden County, so Springfield area, or Franklin County, so Greenfield up north. And so, really looking at specifically opioids right now, because that's a huge health concern, still is, even though it's being a little bit overshadowed by current events, and sort of the interactions between mental health and substance use.
Awesome. And so what do you do for fun?
For fun, well, right now, I'm
In an ideal time, I guess, right?
yeah. Well, I like to spend a lot of time outside, and so this is one of my favorite times of the year when the weather gets nice. I like to ride my bike a lot. I like to take hikes or take walks, and so I do that in my regular life, and I'm doing that a lot right now, which is really nice, a good outlet. And I love music. I love to go see live music in particular, and so that's something that I'm really missing at the moment.
Yeah.
And so listening, I'm listening to music, but it's not quite the same. So yeah, those things. And I like to cook and just work in my garden and sort of putter around at home. So
Awesome. At least we live in a time now. I mean, if I rewind like 20 years ago to when like the internet was really booming with music and this and that, I too I love music. I love live music in particular. The amount of money that I've spent on going to concerts, I wouldn't want to admit online, especially even like certain the amount of times I've seen Radiohead is probably just would make some people sick. But I say that because at least now we live in a time where if it's something that you appreciate live music, I mean, you can now just so many bands, so many, even if they're small acts, you can just have tons and tons of live shows that people post. And yeah, it's
yeah,
never the same, but you can still put the headphones on and just really kind of lose yourself in it. Definitely not the same as being there, but at least that
yeah.
option is there.
It's true. And actually, right now, there are a lot of musicians as a way to stay, especially smaller musicians, as a way to stay viable, are doing a lot of like living room concerts and live streaming those on Instagram or on Facebook or social media, what have you. And that's been kind of fun. And it's also sort of funny to see these acts that you may spend a lot of money on to see that are just sitting
Yes.
in like hoodies in their bedrooms or in their living rooms playing
I,
shows.
I think it also highlights some real raw talent, right? Because when you go to a live show, there's the production value that goes into things, and how much, how many people are backstage tuning the guitars, and um,
Yeah.
piping in the audio filters and everything. But then when you just have one or two artists, yeah, in this tiny setting doing this thing, it really makes you look and say, my God, these people are just amazingly talented.
Absolutely. Yeah. So that's been a highlight.
Awesome. Okay, so your students, that get to know you in the
Mhm.
classroom, you know, um, they're probably going to watch this, and hopefully they're seeing, the human side of you that they wouldn't typically see, when they're in the class with you. Now we ask you what you do for fun, but I'm kind of curious, what's one thing that you think your current students don't know about you that you think they might find interesting?
Oh, I am not prepared for that question, actually. I need to think about it. Um, I've done a lot of traveling, and I've done a lot of traveling. I was actually born in South Africa, so I'm
Wow.
lucky to have dual citizenship, which is a mixed bag, but it's cool, I suppose. I have an option to go somewhere else. But I've done a lot of traveling in my lifetime, in part because we are immigrants, my family is, so we would travel a lot back and forth to South Africa, but we did a lot of traveling when I was a kid, and I took that on as an adult, and mostly traveling in a lot of developing countries. So places like Haiti and India and Laos and Thailand
Wow.
and also road trips across the US. So lots of traveling.
That's awesome. That's awesome. So, okay, so here we are now, right? It's been a couple of weeks since this is, there was a time, right, which seems like forever ago right now, right, where all of what is now reality was abstract, right? And
Mhm.
so in our role as educators, there was, kind of the ramp up time as to what did we think it was going to look like when it was abstract versus now that we're actually implementing it. And there was certain fears or confidences that we might have had. And then now that we're on the other side, some of those have come true. Some things are harder than we thought. Some things are easier than we thought. So can you talk about yourself in the transition about like, what were some things that you were either afraid of that became easier or things that you thought would be easy that became harder?
Well, I'll say first off that I came into this with quite a lot of experience with online teaching,
Oh,
both
good.
synchronously and asynchronously. So I didn't really feel concerned about that at all. And I still feel pretty confident about that. So that's not a worry, which is great. I feel really lucky because I know that not everyone is in that same boat. And I will say this is not a paid plug, but I will say that Springfield College has done a really good job communicating to faculty, offering trainings, being really supportive about making sure that the student experience is a positive one. So that's really great. For me, I just finished my dissertation technically September 1st. And so I spent the last year writing in isolation,
Sure.
and I like my own time. I'm happy to do introverted things, but I really like people and interaction. And so I was really loving going to work, being around people, getting coffee, chit-chatting, seeing students, having people come by my office. And so that part, I really do miss that. I miss the getting up to go somewhere. And for me, the routine is hard. I have a little office right now that I'm sitting in, but it's the routine is tricky for me. It's really easy for me to look out the window, like yesterday, and think, oh, I'd like to go outside, or go into the kitchen and then realize I have to do laundry or what have you. So I don't think that's an experience that is limited to just me. I think a lot of people have struggled with that, staying
Absolutely.
on task. Yeah, so I feel like that's starting to get a bit better. But yeah, the first, especially, I felt like there's like an ebb and flow. So some weeks feel really good and some feel
Yeah.
like quite a slog. So it's a good week this week.
Good. Well, that's good to hear. Two things I want to mention about what you just said. Not a paid plug, right? I do think Springfield College has done a great job, and later on this week, I'm going to have another one of these conversations with one of the people who's been really key in a lot of that communication. You and I both know Chris Hackala, and a lot of students on campus know him, and I'm looking forward to that conversation because he's been really dynamite about helping other people.
Definitely.
Secondarily, yeah, and so secondarily, so one thing that both of our mutual students probably don't know is that we had met when you first joined Springfield College, and we'd had a couple of lunches and a couple of coffees at different events and this and that. And I think I remember saying to you at one point, some of the things that I was trying to do this semester was get out of my office more and just enjoy the campus more, because we do have such a lovely campus and a lovely environment, and such lovely people that we work with. And here we are. It's like this thing that I wanted to try to do, I all of a sudden can't do now.
Yeah. Yeah. I haven't actually been to campus, and I don't think we're supposed to go to campus. So there's things in my office that I need, like that I would like, some advising
Sure.
materials, etc. But yeah, I've heard from some people that have gone to pick things up that it's really strange to go to campus because it's just
Yeah, you're
completely, I mean, there's a handful of students there, I do know that. But yeah,
but
very,
just that
very
hustle and bustle, and just like just the really positive environment that the students, the families, that everybody always says about that atmosphere at Springfield College. It's weird when you remove that. It's just this this place that has these other memories and these other feelings that you're used to having, and a lot of that is not there because of the human, well, just the humans not being there.
yeah, yeah, absolutely.
So, you're someone, so that is wonderful that you've had the experience teaching kind of in this modality. So, like you said, some people might have had bigger fears than what you had going into this, but you're also interesting in the sense that you're teaching graduate students, and I think you're also teaching a course that is mostly freshman undergraduates, right? So
Yep.
this is a really interesting spectrum that you're teaching. So how do you think that this is affecting those populations, and how are you trying to adjust to that?
Well, I think that's a great question. And I think it's such a range. So I have some students that are graduating this year. And I think that's really, I don't envy them being in that position. I think it's a really unsettling time that was a time of hope. I think everyone was probably getting excited for
Yeah.
the end of the year and graduation, all the celebrations and new jobs, and just ready, that bittersweet transition of leaving and starting something new. And I think that's, I haven't really brought that up yet with those students, but I have no doubt that that's very unsettling, because there's a lot that we don't know about the economy and what things are going to look like. So yeah, so there's that. And then for freshmen, I feel like so my class, I teach Health 100. It's predominantly first year students. I think there are two sophomores in there, and I think in many ways for those students it's similarly unsettling. But at the same time, they're kind of right in the beginning. And so I went back to school initially in 2008 or 2009 when the economy was kind of tanking, and it was a good time to do
Sure.
that and to sort of muster up some skills. So yeah, and so what I think the thing that sort of surprised me a little bit about class, well, not really, is that everyone is talking about coronavirus. It's everywhere. And so on the first day of class for the freshmen, I put them into little, breakout rooms as we can do in Zoom, which is great, and popped around to check in with people. And everyone was just talking about, and I tasked them with just talking and
Sure.
catching up before they started to do work stuff, because I think that that's really important. And I do that in every class and make sure that there's just some time for checking in, conversation. I don't discourage that in a way that I wouldn't. I would be a little more lean. I mean, I let that happen in a live session class too, but it's different because I know they're not getting that social connection. But I was really struck by the fact that every single student was talking about how many cases were in their town, what was going on, what was the status. And so I feel like there's this balance that it's everything that people are talking about. And I'm trying to figure out how to read people. And I think I'm starting to do that a little bit better, is that I feel like people have a threshold. They
Yes.
want to talk about it because it's what's on their minds, but then there's this shift where they don't want to talk about it anymore. And, I think for me, what I've really tried to think about is that my classes are health and health topics, and sometimes those can be heavier, on the heavier side. So I've
Absolutely.
really tried to be conscious about finding content that's more uplifting, a little bit more engaging. So for example, when we first came back to class in the freshman class, the first day assignment, I had them all look for examples of people helping other people in their own community, including themselves. And I
Yeah.
think that was a nice spin. So I've tried to focus on that a little bit more, so it's not just stressful.
Yeah, and this is part of history now, right? That I mean, as you teach these types of classes in the future, right? It might be very easy or a lot easier to look back then and say, well, what implications did this have, or did that phase of this have, in different pieces that affect, health or health promotion. You can probably have an entire course in the future dedicated to it. But like you said, right now that we're in it, I mean, you can see it on certain people's faces, but that doesn't mean that just because people are good at hiding things. I mean, we don't know where student stress level, or just people as a whole, how people are reacting to just the isolation and the uncertainty and, what's
Mm.
going on around them. And if you turn on the news, I mean, everything is like, it's horrible.
Yeah, I've been avoiding it mostly right now.
Yeah.
For sure.
Yeah, I don't blame you. But that's, it's got to be interesting for you though. I mean, so me teaching mostly physics or math, I can relate to this in some ways by talking about, predictions or modeling,
Yeah.
data, and the importance of good data, but I can't speak to the epidemiology or to the cure or to how the spread, stuff like this. But it's got to be interesting for you to be part of, someone who is in a faculty position. People look to you for answers, right?
Right.
In a time of crisis that is somewhat connected to your field.
Yeah, and I don't think I've had people ask me questions specifically, like students, but we've been having those, but I've been facilitating those conversations, particularly one of the grad classes is issues in public health. So a lot of what we've talked about, I mean, I said to them, I think on the first day of class, the key thing in public health is that balance between how much power should the government have in terms of telling people what to do versus how much power should individuals have, how much autonomy should they have, choice to do what they want to do.
Right.
And so it is, from an intellectual standpoint, it's pretty interesting to see a lot of the issues that we've been talking about in that class in particular
Oh
play
man.
out around, the government control, education, communication, and also inequities. So we see a lot of inequities in terms of race and income levels, in terms of how different people are impacted. And so a lot of the things that we're talking about in class and somewhat in the freshman class are playing out in front of our eyes. And so that's
Right.
it's very interesting. And it's more that I'm facilitating those conversations, not weighing in as an expert so much, unless
For sure.
someone's saying something that's completely non-factual, then I may, but
Right. No, it's great. I mean, but it is weird. Like, it's one of those things, right? Even the idea of college as a whole, right? A particular class, one individual class is like this abstract entity, but it comes from something physical, and maybe it's like just because of timing, or you don't see how it interacts with the big picture of your curriculum. But here we
Hmm.
are, like you said, we're in a moment where all these topics that are literally coming alive, which hopefully we didn't want them to come alive in this context, but like it just shows the relevance of what we try to bring to the classroom.
Yeah, yeah. Well, and I think I've, of course, heard some public health people say, well, we're going to have a lot of people focusing on health in the future, because sometimes we don't realize what the importance of population health,
Yes.
and beyond just telling people individually to do this or that. And so I do think there'll be a little bit more awareness of what public health is and what health promotion is. So that for me is a positive. Of course, I don't want all of the negatives, but that will be, I think, a positive in terms of just better sort of collective consciousness about that idea of what can we do to promote health of everyone, not just individuals.
Right, and the one that I never really thought about, and again, not my field, but one of the things that this crisis has brought to my attention is the interaction between the health of the individual and the public health, right? Because if some of the data with asymptomatic cases and stuff that you might have people that say, oh yeah, well I'm going to be totally fine, so I can do whatever I want, but that has some greater effect on the public as a whole. We spoke with Bob Gruber about this, about just the ethics of these decisions, that yes, you can have the individual piece and the societal piece, but they are definitely related, you know?
Yes, absolutely. And there are a whole host of ethical decisions that people are bumping up against now, which I won't necessarily go into because they're all a little bit depressing. But another one of the things I was thinking about too is that even in all of my classes, I always spend time talking about critical thinking and information and where do you look to get good information. And so I think that idea that you were talking about, the sort of individual versus collective health, is that, I think unfortunately the media broadcasts this message in the beginning: young people are not at risk,
Yes.
and it's just people that are older with underlying chronic conditions. And of course, it's not just, in public health and in equity speak, we say the best marker of how a population does in terms of health is how they care for the most vulnerable in the
Right.
population. And so that would be, the most vulnerable. So elderly, people with underlying health conditions, pregnant women, babies, that kind of thing. But I think particularly now, I think that messaging was confusing because I went for a bike ride yesterday and I see a lot of young people that don't look like siblings, that are clearly friend groups that are all very close together.
Yes.
And I think that messaging kind of sank in a little bit to people, that like younger folks are fine. And it's true that for the most part, they're not very impacted. But when you think about individual versus the collective health, they are families, and then young people are one of the key spreaders of the virus. So
Yeah, totally crazy. So, all right, so you teach this wide spectrum of students, and I'm sure that you have a fantastic relationship with them. But hopefully, some other students that you don't typically interface with are going to watch this. My students in particular, and some other people that will watch this. What message do you have for students as a whole, either your students or just a generic student as they're going through this? What message do you have for them?
I would say a few things. I would say, first of all, don't be so hard on yourself. If you're someone that likes to do a lot of things and be very busy, and sometimes you find yourself feeling kind of sluggish and unmotivated, I think that's okay. And reminding yourself that everyone is having those kind of ups and downs. And I would say most importantly, number one would be prioritize your physical and mental health. So, sleep, binge watch TV if you want to, eat well, get some exercise, connect with people. Don't spend too much time on social media or the news if it's full of coronavirus stuff, because I think that can be overwhelming.
Yeah.
Um, and yeah, and at the same time, also try and create some type of routine to help you stay on task or feel some sense of normalcy. So yeah, I suppose those are my two big things. And find things that you enjoy doing, or maybe teach yourself something that you've always wanted to learn how to do with some of your downtime that you may have. And also, if you're working a lot, thank you for going to work, because I know a lot of students are putting in extra hours in grocery stores and are very busy and overwhelmed. And to communicate that to your professors, because we're all understanding that it's a really difficult time and people have a real range of experiences in it.
Absolutely. I think that last piece is key too, right? A, the thank you, but B, that that communication, that we're in this together on the other side, right? As faculty, that the more that we know, we're not looking to, you know, make this more of a miserable experience for people than it already is. And so the more information that we have, these are, we are people that we wanted to work at a small school, so we wanted to have that close environment with students, and it's through no fault of our own that it's not the students' fault, not our fault, that position has been slightly changed for this limited period of time. And so anything that we can do to maintain that connection through communication, I think is very key for all sides of this.
Definitely. Yes.
So with someone being someone with experience teaching online, and not all faculty are in that boat, there are some people that I know that, again, I'm actually learning a lot from this. I've taught online before, but there are some parts of this that I find very interesting, that I can do some different things. So I'm having as best of a time as I can without doing what I love of being in the classroom. But I know that not everybody is there, and some other people, this is as close to they come as a nightmare scenario. So what advice do you have for faculty in general?
Well, I would say it's kind of similar to the advice for students, which is A, don't be so hard on yourself. I think there's some great articles floating around there about, where's your bar exactly. Similarly, prioritizing mental and physical health, number one, and communicating and letting students know and acknowledging if you're struggling with it, because I think that we all appreciate clear communication. So just letting students know, I'm trying my best, but this is really hard for me. And also reaching out. And so I think our department to other faculty, so our department has done a good job of doing interdepartmental trainings about some of those things.
Sure.
And also we have now a weekly check-in during the work week, but then also some more social, like virtual cocktails or non-cocktails, just to sort of
Awesome.
check in and support each other. And get some feedback as well. And so know that there's some growth that can happen. If it doesn't, don't worry about it.
Yeah, I'm going to start. I'm going to try just little things to try to, I do these weekly check-ins with my department. So I'm going to try to say something like, like bring a wig or something to Zoom and get, see what
Right.
we can get on there.
Like, good on you. It works.
Yeah, well, we'll see. I've somehow amassed a collection of wigs over the years, which is another conversation for another day.
As well as a guitar, perhaps.
That's right. They may or may not go hand in hand, right? I have a feeling the answer is going to be similar, but what message do you have for people that are not in academia, just humanity as a whole, that's going through this really bizarre thing that, I mean, obviously we talked about how it affects our life and our profession, but what about just people in general, especially being someone, who can speak on the idea of health and health promotion?
Well, I think for the general public, I think the key would be to be conscious of where you get your information. So what I tell students would be look for websites that end in .org, .edu, .gov, and get your information from trusted sources. Versus, even if you're getting information from friends or social media, make sure that you check it and don't assume that it's correct.
Sure.
And I think that's really important. Also, just follow the guidelines that are set out by the CDC, cdc.gov, Centers for Disease Control and Prevention. That's where our tax dollars go to support that. So they have some really great information. And then again, similarly, focus on mental and physical health as much as possible, no matter what. Number one, reach out to other people. And what I've really enjoyed is looking around in my neighborhood as I get out and seeing little signs, like I see like kids have painted little rocks or done chalk on the sidewalks, and put little messages. Like I saw one, I drove by a house the other day and it just had this spray painted sign that said, help each other.
Yeah.
And I thought, looking out for little things like that are really nice and are a source of hope at this time.
Awesome. So if we could erase, we spoke briefly before about music, right? And
Mm-hmm.
if we could erase coronavirus and, somehow like magical tickets fell into your lap to go see whatever performance you could see, who are you going to see this weekend if that was the case?
Oh, that is an impossible question for me. I mean, it's such a range of my musical interests, but I'll tell you that the things that I had sort of coming up that I either can't go to or were canceled or I'm hoping will still happen would be, I was supposed to go see Stephen Marley. I was supposed to see a band called Mipso. I have tickets to see a band called Parquet Courts. And then the Newport Folk Festival and the Green River Festival, which happens locally and is super fun. So I'm hoping some of those summer things will happen because
Right.
music and summer go well together.
I say it wouldn't be the same without, being able to wind up somewhere, whether it's, late afternoon or early evening with, an outdoor stage and a good band and,
Yeah.
being able to be outside with, not 10 layers of coats on or stuff like this. And God
Right.
forbid, be able to interact with people again,
Yeah, we will. We will.
Awesome. Well, thank you, Alice, for taking the time to do this today. I hope that your students find this conversation, at least if not interesting, something outside of their normal day, the way their new normal day looks. I know I found this conversation interesting. And like I said, I know you're having Tuesday meetings with one of my other friends, and so maybe I can film one of those as well.
Oh yeah. Oh, that would be fun. That would be really fun. I would
Awesome.
love that.
Well, thanks again, and I hope you have a great day.
Thank you. You too. Take care.